Hi, I'm Peter Glowicki from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. I'm pleased to introduce to you 4 great papers from the September issue of the JVS. This month, the Editor's Choice article is entitled "Using the Society for Vascular Surgery Wound Ischemia and Foot Infection Wi-Fi classification to identify patients most likely to benefit from revascularization." This multi-center study was written by Jessica Mayer and colleagues from Houston, Texas, Worcester, Massachusetts, and San Francisco, California. Based on the difference between predicted and observed lower extremity amputation risk for 1,654 limbs that underwent revascularization, the Wi-Fi scores were placed into quartiles from highest to questionable benefit of revascularization. Observed amputation rate in cluster 1 was only 4.4%, while in cluster 4 it was 51.2%. Based on these data, the SVS Wi-Fi score identifies which patients with chronic limb-threatening ischemia have the greatest and the least benefit from revascularization and may provide improved prognostication, risk stratification, and outcome assessment. Our Cime article this month is entitled "Practice Patterns in Arteriovenous Fistula Ligation Among Kidney Transplant Recipients in the United States Renal Data Systems," authored by Caitlin Hicks from Baltimore, Maryland, and her colleagues. This retrospective study found that out of 16,845 patients with kidney transplant, only 4.6% underwent AV fistula ligation. Still syndrome was by far the most frequent cause of ligation in 77.2%, followed by AV excess infection or aneurysm in 2.7%. It's interesting that there was no association between fistula ligation and allograft failure, and there was no association between ligation and all-cause mortality. The authors concluded that AV excess ligation after kidney transplant can be reserved for excess-related complications because systemic benefit on allograft failure or mortality appears to be minimal. The next paper I would like to bring your attention to is on hybrid surgery for bilateral lower extremity inflow revascularization, written by Sam Dorodgar-Jorshery and colleagues from New Haven, Connecticut, and Columbus, Ohio. Now, this is a retrospective NSQIP study that compared 30-day outcomes of 571 aortobifemoral bypasses to those of 193 iliac artery stents and femoral bypasses in a propensity-matched analysis. Patients who underwent aortobifemoral bypass had significantly more pulmonary and cardiac complications and composite morbidity than those who had a hybrid procedure. Aortobifemoral bypass patients also had a significantly higher 30-day mortality and a longer hospital stay. So the take-home message from this paper is that hybrid surgery for bilateral inflow revascularization, whenever it is anatomically possible, has favorable perioperative outcomes compared with aortobifemoral bypass. The final paper we would like to introduce to you discusses how multidisciplinary clinics reduce treatment costs and improve patient outcomes in diabetic foot disease. Now, this paper comes to us from Auckland, New Zealand, and it was authored by Maximilian Joré and colleagues. This retrospective study compared outcomes and costs in a large tertiary hospital before and after introduction of a multidisciplinary foot care clinic. The multidisciplinary team consisted of a vascular surgeon, a vascular registrar, an endocrinology registrar, a podiatrist, a diabetic foot nurse specialist, and an orthotist. After institution of the diabetic foot clinic, there was a significant reduction in hospital admissions. There were fewer major amputations, mortality decreased, and total costs were significantly also reduced. So this study suggests that a multidisciplinary foot clinic can lead to improved patient outcome at lower costs. These were just 4 of the many excellent papers from the September issue of the JVS. You can download them this month free of charge at www.jvassearch.org. Enjoy reading all JVS journals and let us know how we could serve you better. Thank you for watching, and see you next time for the highlights of the October issue of the Journal of Vascular Surgery.